Hello, my name is Dr. Rama Akachuku. I'm a family consultant with a subspecialty in women's health and female adolescents, and I also subspecialize in general obstetrics and gynecology at Euracare. So my work involves looking after women from every stage of life. So before they start their period, when they start the period, which is known as menarche, throughout their teenage years, then we go to the reproductive years, then we go to postmenopausal. I also work as a family consultant, so I see a bit of everything. I studied medicine in University of Debrecen, which is in Hungary. So that was a 6 years medical program, and it included an internship program. And then I worked in Ireland, Republic of Ireland, and I trained as an obstetrics and gynecology up till subspecialty senior registrar. Then I trained as a family physician, which is also known as general practice in Republic of Ireland. And I completed up to a consultant level and I achieved my membership in that as well. Gynecology is very important, and I think every girl and woman needs to know about it because it involves our body and it involves the changes that our body go through. So we have different stages in life. So for example, a lady will start her period at a certain age, and then she might have issues with her period. Then she might want to, have start having babies, then she might have issues with that, or she might not. And then she will also go through menopause as well. So she needs to understand what gynecology is. She needs to understand the supports that are out there for her to navigate her body and not let her body control her. Women's health is my passion. I feel like I have butterflies in my tummy when I talk about women's health. So when it comes to my package includes, non-judgmental approach to the lady. I want to listen to what that lady is telling me. It's not just about what she's saying. So it also includes what her facial expression is telling me at that time. I want her to be comfortable. I want her to know that I'm here for her. And I want her to know that she's not just coming now to treat that issue now, that issue might need a follow-up visit, and she's still going to be the one driving that ship with me. So the reason why I do a package in Euracare is that there's an initial consultation and there's two extra reviews included in that package. It gives patient that empowerment, that charge, that okay, I know what's going on with my body and I want to come back and see that doctor and have um, a better outcome. Because if you just do one visit and say we wait for the bloods to come back before you give the patient the right plan, it could cause two things. So you could get the wrong diagnosis, which could happen because the patient might not have said everything. It could also lead the patient, getting information elsewhere from either social media or from their friends or relative. But if you have that package, that patient knows that she can always come back. I also see menopause, which falls between the age group of 49 to 52. The reason for that range is because menopause is becoming earlier in a community like this here in Nigeria. So it's not your usual age 51, 52. I cover cervical health and as well as sexual health. And I also cover urogynecology, which deals with pelvic floor. So women that have issues, controlling their urination or having what is known as a vaginal prolapse that can happen during childbirth. So it's a lot. So I see all age group in different segments and different ages. So I think what I would like to resolve in women worldwide, not just Nigeria, is to let them know that the body goes through a lot of changes and you don't have to walk this journey alone. Here at Euracare, you have myself and you have a great team here as well. And cases like endometriosis, adenomyosis, PCOS, hormonal imbalance, perimenopausal symptoms, and the one that people are very ashamed to talk about, like your sexual health and your weak vagina muscle, which is under the urogynecology specialty that I offer. You know, these cases have the support that you need. So I don't want you to shy about it because here at Euracare, I offer non-judgmental approach. You are very important to me. and I work with you. So I'm not that kind of doctor that decides this is what we need to do and that's what you're going to do, and that's final. What I say to my patients here at Euracare is that you are the boss and I work with you to provide evidence-based care approach.